When coffee break keeps running and running, it means you've got lots to talk about, and that's why we ensure we have a half-hour coffee break so you can network and really catch up with people and make strong friendships, links, and even do some business as well, which is good. I really got some great feedback from everyone about this morning's session. I think everyone here who didn't know a lot about the course have learned a lot about it. Some people are thinking they wish they were on the course. And I know even from talking to our Graham Love, Dr. Graham Love from our state agency, he's now asking questions, and Sharon was saying, ask us. He's now asking questions. How can I get some of these people involved in what we're doing here? So that's exactly what we wanted to see, which is great. The next session is the is going to focus a little bit more. It's the introduction to the breakout sessions, but we want to get you thinking about national level. And we've got three panellists. Very privileged to have Silvano Berioli, who's from the European Forum for Good Clinical Practice, but has also been very involved in the setting up and driving the setting up of the Italian platform. Daniel Gil here from Pharma Industria in Spain, also been paramount in the work that's been done in Spain. And I know that there's been a lot of action as well on social media, etc. And I know you're probably going to have a little chat about that. And Rosalina Lepatatu, I hope I've pronounced your name right, who's from the Autoimmune Disease Patient Association in Romania. And one of the things we talked about, the 12 countries that EUPATI have focused on. Obviously, Romania isn't within that 12, but they're so encouraged and enthusiastic about what we're trying to do. They're going to do it anyway. And isn't that what this is all about? And we talked about the fact that our information, that our educational tools, they're going to be available to the public to utilise. So I think that's great. So without further ado, Silvano is an Italian medical doctor and was born in Italy. His experience spans work as MD in Internal Medicine Institute of University of Perugia. Is that right? Yes. Where he's also completed his specialisation in cardiology in 1990. And before that, he achieved specialty in hygiene and preventative medicine in public health at the University of La Sapienza in Rome. Yeah, I have to get better at in Roma. Yeah, he then moved into drug development with a company specialising in cardiac drugs. And I'm going to leave it there. And one thing I would like to say is I've worked very closely with Silvano since the start of this project. It's been a privilege, and I think I'm really looking forward to hearing what's happened in Italy and what's about to happen. So thank you very much.
Thank you. Thank you so much. Good morning, everyone. Thank you, and thank you for being here. And I'm really proud to be here and representing the National Liaison Team of Italy. And without these people, it would have not be possible to overcome all the challenge we have, the hurdle we had. And many of them, of my colleagues, are here in the room. So thank you for your support and your dedication, your commitment. And what I think it's important is that we face a lot of problems as in any country. And now I try just to list you what we have been going through during these years from when we started to coagulate the project in Italy. First of all, keep in mind that probably as many other countries, there are so many patient organizations. In Italy, there are more than 9,000, and you can guess how difficult it could be to put these people together. In addition, the heterogeneity. Of course, there are many kinds of patient organizations, and sometimes for the same disease, also more than one patient organization. What about the capacity and the attitude to manage the patient organization? You can guess that also in this way it's not a uniform way of doing that, and so it's difficult also to speak with them and to make some project in a progressive way. The other things that I think is not secondary at all is the financial part. So to have resources is not easy. It's not easy because as long as you are not listened by the institution and the other, you are more or less navigating in this 9,000 of organization, and nobody is listening to you. So we have to find a way to be listened by the people who is important. And another problem we find, and I think this is also something happened to many countries of your experience too, is the jealousy of their own network. So when we started to share is something important, but we have to be willing to share, and not just by talking, but just doing things. Another important thing is also the way of interaction between patient organization and pharmaceutical company is not univoc. There are many ways of doing that, and we realize that there is no a standard way of being this kind of cooperation in a very transparent and efficient way. Then it is another little story. I don't know if in your country happened the same, but when the patient organizations are big enough to be on the spot, sometimes we have people who want to keep this as a leader, and they are ex-politicians or people who want to use this position for their own agenda. And this is something that happened in Italy too, and we of course have a reaction to that, but this is another story. But just to tell you that how difficult is this kind of situation to face. And also the media that doesn't give us a lot of help. Sometimes they are just suspicious, oh, it's one of the many other projects around. And we try to explain, no, it's not another, it's the project, and we have to think about that. So we have a lot of enthusiasm and propagating our way of seeing things, and finally I think that we receive the success we deserve it. So hold this harder, how we overcome to this. And I think that our crucial strategy was to have a central strategy and a local strategy, and the two things was a winning combination of the two. When I speak EUPATI central strategy, I mean one of the idea we have was to create, to invent the figure of mentors. And mentors is a people that in our understanding was people who have to have a knowledge and understanding of the political and environment, so be aware of what's going on in that country. And so going to the local strategy, being the central clear to us, we try, of course, to start when we create the National Liaison Team to identify ideal people. Can you guess how difficult it was? 9,000 patient organizations. So the idea we have was to select an intermediate level of patient organization with a long experience, not too big, not too small. As I said, I needed people with a pedigree for this kind of work, and people who are able to be friends to everybody, don't create obstacle, opposition. And I was lucky to find the people like this, and I have to say thanks to the chairman, it is Filippo Buccella, our national chairman, and all the others that work so nicely together. Of course, when you identify the people, then you have to decide how to work together. And we have to be very clear what is the availability in time, what is the role of each one. And you have to take a sort kind of division of work. So, and this is the only way that a team like this in this project can work. Of course, what are the important is the support and the partners. We need the institutional part, and you know, for the fundraising reason, it's very important also for receiving income from the pharmaceutical company, support in kind or cash, whatever, that you have to have an institutional partner. And in fact, we were lucky. We have been the first in Italy to receive the endorsement of AIFA. AIFA is Agenzia Italiana del Farmaco. It's a very important institution in Italy. And we get this support among all the other company and project and whatever. So it was the first time in Italy that AIFA gave an endorsement. And this for us was really a great image. And also the HISPOR, that is an international society for pharmaconomics and outcome research. They also give us a big hand. They are people who are working in statistics and research. So that was another important endorsement we get. Of course, we have not to forget this kind of balanced approach also with the academia and also with the pharma industry. So we find altogether a way of a sort of standard approach how to involve these people, and having a meeting with them just to explain and repeat what EUPATI mean and what is the importance of the transversality of this project. Of course, to make the first step in a positive way, we have also to count on our knowledge or the people who can be available to us for the first step, and things that is not so easy to get this kind of approach. But of course, we have to make your best in your country to make some initial positive contact, also to give a breath to the project. And our cornerstone event was first when we signed the Memorandum of Understanding with IFA. It was in July of the last year, and it was really a great achievement. There was a lot of mediatic response to this, and thank you to Ingrid that was really having a contact in advance with the director of IFA, that is Professor Luca Pani, who was for the first time personally engaged, and he was also then later on involved in the creation of the board of the ENP, where also we have to try to put all the stakeholders important in Italy transversally with the pharmaceutical company. We have the farm industry inside, and a patient organization and academia. So that's where how the steps progress we reach. And then to manage and to continue to manage the situation in an operational way, we also face the problem how to get money, how to get funding, how to find the resources. And we decided that it was necessary to create an ONLUS, it's a non-profit organization, that was called ACCADEMIA dei Pazienti, Patient Academy, it's in Italian, of course. And together with the board and under the leadership of the Comitato Esecutivo, an executive committee that is constituted by the member of the NLT, we were managing the creation of the EUPATI National Platform. At the moment, we have more than 200 patient organizations, and also academia is represented, the industry and the media. So not too bad for the moment. We are looking to expand this kind of involvement. And the event we have planned for the 2015 are mainly two, and the first one has been already done, achieved by the 10th of this month, so last week, was an important event in Italy. Many people were participating, and we have also in this case a lot of enthusiasm and positive involvement. We are also planning another event, a workshop, two-day workshop in autumn, and there we would like to also produce a result of what we are going to do in this month and the next month, having the possibility that the member of the platform can provide proposal and ideas, and these ideas will be evaluated by the scientific board. So it's a sort of well-established pathway to go through, and for doing that we try also to use technology. Of course, if people wanted to make a proposal, we have to understand which kind of proposal. So we categorize in a website that we created in Italy a sort of a typology of a contribution in different arguments. And this was very useful, it will be very useful, because the proposal will be evaluated by the member of the scientific board depending on their competence in a predefined format. So this is just to give you how we organize. There will be the invitation in the next months, there will be the collection of the proposal, then there will be the evaluation by the member of the scientific board, and then there will be the communication on which proposal will be accepted and bring ahead. And finally, in the workshop in the autumn, they will be presented and discussed. So this is just a short overview of what has been done. And again, we have a lot of enthusiasm, but also a lot of help by the central intelligence of EUPATI that never let us alone. Anytime we have asked, they are come with us and also speaking with the important people. So my encouragement is to go ahead also in other countries. And if you need whatever help or whatever suggestion, and you think this what we have been done is useful or interesting for you and for your country, you just can hook to us and give a call, and we will be able to provide you whatever we have done. So thank you very much for your attention, and I pass on to my colleagues.
Thanks, Silvano. I should have brought a spoon because I was banging the glass with my finger, so because I'm conscious of time, because I do want us to get into our groups by 11, so I apologise for that. I want to just quickly introduce Daniel. He's been very involved in the project, both in Spain. He has a law degree and a master's degree in journalism. I think what I really want to highlight is the fact that you're editor-in-chief of an online platform for patient organisations developed by pharma industry with over 15,000 entries. And since 2013, Daniel is the representative of Pharma Industria in EUPATI and a member of the Spanish platform. And I think Laura and I would both like to thank Daniel for all his support in that regard. So.
Well, hello, good morning to everyone. First of all, I want to thank EUPATI for asking me to participate today in this workshop, and especially Laura Kavanagh. Excuse me for my English, I hope you can understand me properly. As Evelyn has explained you, I represent, I am part of the Spanish National Platform representing Pharma Industria. Pharma Industria is the National Pharma Companies Association in Spain, so I'm the representative of the companies in this project. I will try to explain you very briefly what have we done already, what are we doing in these moments, and what do we think is needed to be done in the very next future. We started to work as the NLT in Spain since the very beginning of 2013. We've been in this path for partners. Two big patient organizations, GEPAC, that is the Spanish Cancer Patients Group, and FEDE, that is the Spanish Diabetes Patients Federation. Also in the NLT was represented the Universidad Complutense, the main university in Spain, in representation of the ACCADEMIA, and it was represented in my person, Pharma Industria, the National Trade Association of the pharmaceutical industry in Spain. That year it was a bit difficult because the four partners had suffered, three of them suffered some changes during the year, but we afforded the launch of the Spanish EMP last year. We think that the key moment for us to give that step was the appointment of Laura as the EMP coordinator in the EUPATI consortium. That first step we gave was to celebrate a presentation event of EUPATI in Spain. It was the 4th of November last year. We were with around 100 participants representing patient organizations and pharma companies and some academic organizations also. And in that event, we had our first collaboration with the Spanish Medicines Agency. Concha Prieto from the agency came to the event, and she delivered a speech on patient involvement in the R&D process. And from then, we are trying to collaborate very deeply together with them. The second step that year, the last year, was to establish the contact with the Spanish government. We held 2 meetings last year with representatives of the Spanish Health Ministry. In July, that second meeting was with Paloma Casado, that is Vice Director in the Health Ministry, in charge of relations with patient organizations. In our opinion, at the political level, they are still not ready to understand the project and to engage with EUPATI until they learn more about the role of industry and the influence on patients within the project. That's one of the facts that makes us think that it will be easy in Spain to collaborate with the Medicines Agency, that is a more technical level right now than with the political level. But we hope that within a few months they understand what suppose the projects and they accept it and they collaborate. And the third step, after the presentation of the initiative in Spain, was the creation of a small group of organizations, more or less like an executive board. We don't have a formal composition. It's not a new association. It's a group of 9 institutions represented that are trying to manage this project and to develop as much activity related to EUPATI in Spain as possible. No? In December, after the launch event, we held a meeting with all the entities interested in EUPATI, and from that meeting, there were 9 organizations elected to become part of this executive group. There are 6 patient associations, GEPAC and FEDE, that already were in the NLT, but also con arthritis, Lupus Madrid, Menudos Corazones, and ACU. They represent arthritis, lupus, heart diseases, pediatric heart diseases, and Crohn and colitis. In this group is also represented the Universidad Complutense and the Sant Joan de Déu Hospital in Barcelona, and Pharma Industria, the pharma companies represented by the National Association. And now, what are we doing now? We are spreading the news about EUPATI, trying that all the interested collectives, groups, and the society in general can learn what is EUPATI about. We are developing many activities. We've been speaking about EUPATI in a rare diseases event in Hospital Sant Joan de Déu in Barcelona in February, in the 8th Annual Conference of Biomedical Research in March. It's a very interesting event because it's designed for researchers, but we could open a window to a mixed table with patient organizations to speak about EUPATI and the needed collaboration between the different stakeholders. We also spoke about EUPATI in Spain in the training course meeting in Barcelona, and tomorrow we are going to speak about EUPATI in the Semergen Congress for Chronic Patients in Toledo. Next Monday, we are speaking about EUPATI in a Pfizer forum about R&D in Madrid, and we hope that before the end of the year we will be able to participate in 2 or 3 more events, and at the end of the year, as I will explain now, we will try to repeat a big event like a workshop like we did last November. We are programming our activity for the next months. We are developing an action plan with 3 main axes: contents, those developed by EUPATI, or also looking at contents developed by third parties but aligned with EUPATI objectives. We are programming activities, thinking of new educative initiatives and organizing events. And we are working in communication, trying to spread the news via mass media and social networks that we have already started. And we are also working with stakeholders. As I told you before, EUPATI is collaborating right now with 2 pharma companies, Merck Sharp & Dohme and Novartis, to participate in educational activities designed for patient organizations in the second part of this year. And we know that some more companies are interested in future joint ventures and the possibility of holding events. The MP is also going to ask the Spanish Medicines Agency, AEMS, to collaborate in future informative and educational activities. We think that this can be a more effective way for working together with the government, better than with the Health Ministry, as I told you before. We hope that once the training course has finished, we could use those materials and contents to try to organize some formation activity in Spain with contents translated with AEMS. And we also are working with the 2 main patient organizations in Spain, the Foro Español de Pacientes and Plataforma de Organizaciones de Pacientes, that are already represented in the MP by some of their members and informed about EUPATI activities in Spain. And what we think that is needed to be done, from the EUPATI training course, we just have 1 Spanish student in the ongoing course, Begoña Fría. She's also a member of the EMP, and she will be the first EUPATI tools teacher in Spain. For the second course, we know that there are 20 Spanish candidates, and we hope that in the second course, Spain could have more representatives in this course. And we are waiting for the publication of that course material in English, and our team will then look into how this might be used in Spain and whether these materials could be translated and used to mobilize patient organizations and organize trainings in Spain, as I told, hopefully together with AEMS. Yes, I finished. We are also waiting for the EUPATI toolbox. and we will try to hold a main event at the end of the year to present these materials. It could be our second annual workshop in Spain after the first one in November last year. And all this fits with the new landscape we feel that is being created in Spain. There's a new regulation, probably it will be approved this June, that will allow patient advocates to participate in ethics committees, in the design of clinical trials, and in the writing of therapeutic recommendations. So we think that EUPATI objectives and contents will be very important in these new areas, where researchers, patients, industry, and authorities will have to collaborate all together. And what we hope is that the Spanish EMP will be ready to disseminate the EUPATI materials and to collaborate in this new paradigm. And that's all. Sorry for the delay. Thank you.
I think the delay is all our faults because it took a while to get back from coffee as well. So thank you very much, Daniel. I think that there's a steady stream coming through between both Daniel and Silvano's presentation. It's about drivers, key people who drive this, building relationships and patience, I think. So the next speaker is Rosalina, who's coming from Romania. I'm really looking forward to this because, as I said earlier, this is from a country who's just enthusiastic and outside the 12. And Rosalina worked for the Romanian National House of Health Insurance, but she's also part of APAA. She's the APPA president, building a strong patients community, representing patient rights and helping the autoimmune disease patient to cope with their condition. So you're very welcome. Thank you.
Hi, nice to be here. I have so many friends in this room. It's almost like a family, so it will be easy for me to speak. Romania is the second large country in Central and Eastern Europe after Poland. So we are 22 million people all over Europe working, and another almost 3 million people speaking Romanian, but in the Republic of Moldavia. They are not yet in European Union, but trying to bring this concept and all the material in Romanian will help also our friends from Republic of Moldavia to understand and to develop themselves. What we have now in Romania, we have a very good law about health system, unfortunately not very good in implemented. We are invited to all the debates to the Ministry of Health and National Health Insurance, so everything which is regarding the health system and the patients, usually they are asking us to participate and to have an opinion. Lately we have a participation in hospital ethical committees. What we don't have representation in the National Drug Agency, so we don't have a patient voice in the clinical studies and everything regarding pharmaceuticals. And also we don't have a voice in the HTA meetings. What do you need? What else we need? We need national register and for trials and for chronic disease. And we need every stakeholder to try to listen what we have to say, because usually people, physician, academia, sometimes in pharmaceutical companies, each one are focused on their own goals, that they forget that everything they are doing for our benefit as patients. How we start National Liaison Team in Romania? We started with the first 3 trainees in EUPATI course. Me, Violeta, and Cosmina. We decided we have to bring all EUPATIC knowledge, and not only EUPATIC knowledge, all the knowledge you can get in this world to help Romanian people. We contacted and we have an agreement for, and very important to say that more and more patient organizations are joining us. And I have to mention that in this room we have another 2 representatives of Romanian organization which want to take part of this, of course, Mrs. Isabella and Cristian. We have also an agreement with Mrs. Ruxandra Ionescu. It's a very important and nice person from Romania. She is one of the managers of the Romanian Bucharest University of Medicine and the president of the Romanian Rheumatologist Society. We contact and other representative of ACCADEMIA, and everyone look excited about this initiative. We have media partners. We have mentioned only two of them, but more and more media representatives start to be interested in this. We already contact industry representatives, and we have a very good feedback from them. I cannot nominate them yet because we don't have an agreement, let's say, with them yet, because as maybe all of knows that they need more internal approvals, compliance, medical, legal, so it took some time. But very important is that the people from pharmaceutical industry are looking for this partnership. And we start our discussion with the Ministry of Health and with the Romanian National Medicine Agency. And the people from there like our project, but we have to talk more about all the details. What we done until now, we have several media articles about EUPATI and EUPATI values. We have different presentation in Rheumatology Congress, in other hypertensive and cardiology conference, and in a few days, Violeta will have a presentation to Melanoma Congress also about EUPATI. Why it's so important for us to have this project in Romania? It's very important to have educated people, because we saw that and the patients and the patient representatives don't know exactly what is the meaning of a clinical study, how to get correct information and where to find this correct information, because as you know, on the internet and also in the media, there are a lot of articles not very good documented sometimes, and can induce some wrong ideas and information for the people and for organizations. So we believe that the first brick you put on a wall in our activities is education. So we have to start from this point of view. Also, the education in this manner will help and the patients and the doctors to find a way to communicate and to speak, let's say, the same language, because sometimes the doctor are talking about some scientific information, and the patient is looking like I don't know what, and don't understand anything, and go home very frustrated that he doesn't understand anything about his condition. So I think this kind of project will help everybody. Will have the opportunity to have the expert patients, because as I told you, we already have to be represented in ethical committees, and unfortunately, not all of the patient representatives have all the knowledge to be involved in these ethical committees. So EUPATI will bring us raising a voice, and a voice which with let's say, with a background and with an authority, because nobody will start asking us, why are you doing here, and why are you representing somebody? Because once happens to me in the Ministry of Health, a lady from there asked me, why are you here? And I said, I'm here in my quality of patient, because I know better than everybody what happens to me. So now I will have another argument. I'm here in my quality as patient and the patient expert, because I know what to talk with you about this. So this was my short presentation. I have to tell you mulțumesc in Romanian. It means thank you in English, and I'm sure that we will do this in Romania because I am a very practical person, and all I'm waiting for EUPATI is to give me in autumn the toolkit, because if I will have the toolkit, I promise that in 3 months I will have the EUPATI National Team, and we will start to translate and to implement it. Mulțumesc again.
Ramaya Give, if it's in Irish, thank you very much to the panellists. We're not going to take questions because we all have work to do now. And I think I want to reiterate some of the things Rosalina said. I have a gut feeling there was a lot of tweets while you were talking. You know, my tweet for today is patients know best, you know. Sometimes you hear doctors know best, but patients know best. And that really came through in what you were saying, Rosalina. So I hope you've absorbed all of that because you're going to need it. You're now going into your breakout sessions. So I want you to look at your badge, and they're color-coded. Breakout group 1 is an orange badge, and the orange people are going to the PODDLE room. So it's PODDLE. And there's some signs outside. And breakout group 2 are the yellow group. And the yellow group are going to courtyard 1. So that's courtyard 1. The blue group are going to courtyard 2. And the green group are going to stay here in the main hall. So, oh great, I'm green. Haha. So thank you very much. And when you do go to lunch, and you have your lunch, and you hear the bell, come back in. Thank you. Oh, thank you so much.